to any colleagues who may not have been able to attend, and we'll also share this with anyone who registered but wasn't able to attend as well. We do have a Q&A section on your screen where you can send in questions as we go along. Please feel free to send those in as the webinar progresses. Don't feel like you have to wait until the end. We can stop at any point and answer questions as they come through. There's also a chat feature where if you feel more comfortable sharing your questions there, please feel free to do so. Or if you want to chat with Ryan and I or any other attendees who have joined us today, that's available for you. And then we'll, as we go through the webinar, have a few poll questions that will come up on the screen. We'll pause for about 30 seconds for each question just to gauge your interest and see how everyone responds, and we'll share those results with you as we move forward. Just some quick introductions. I'm Gabby St. Remy. I'm the Director of Marketing and Patient Engagement for CSSI. And I'll give a bit of background to myself here in a second, but I also wanted to introduce Ryan Haynes, who's our Executive Director of Clinical Solutions. And if you were on our previous webinar in February, he led that one, but he's joining us today as our moderator. Ryan, did you want to just quickly introduce yourself?
Yes, thank you, Gabby. As Gabby mentioned, I'm CSSI's Executive Director of Clinical Solutions. I work with our clients and collaborators to develop our overall patient recruitment and retention strategies. I get the privilege and honor of working with Gabby as we build our patient toolkits, which is a vital part of all of our patient recruitment and retention campaigns.
Thanks, Ryan. And just a quick introduction to myself. As I mentioned, I kind of lead our marketing and patient engagement here at CSSI. I've been with the company for over 6 years now, and I oversee our creative and our media teams. So as we put together recruitment materials for all of our studies that we use for our outreach, I'm involved with that process, as well as working with our media teams if we're doing any direct-to-patient engagement through traditional or digital advertising. We'll work together to put those strategies in place and present those and work with our clients, and then deliver those metrics as well each week. Then just to talk about what we're here to talk about today, it's building a recruitment toolbox for your study and those materials that you'll need as you're doing the recruitment process. So internally here, we follow these 5 steps, and they're the 5 steps we'll present to you today as we go through the webinar. The first one being researching your target audience, really understanding who they are, who this patient population is. Step 2 is branding your study. Step 3 is developing the key messaging, and this will be what you use across the board for all of your materials. It's important to make sure everything is consistent. Step 4, outlining your patient pathway, figuring out where patients are going for information related to their health and how you can get your study message in front of them. And then the last step of the 5 steps here is developing the toolbox itself and all the materials that you'll need. So we just wanted to stop for a quick poll question here, and I'll pass it over to Ryan for that.
Yes, our first poll question is, when do you start developing your recruitment tools? And the choices are during protocol development, after protocol development, or I do not develop our recruitment tools, and that's kind of why you're here today. We'll give everyone just about 5 more seconds. And the results are just about split, with half of the respondents, 50%, saying that they developed their recruitment tools right during protocol development, which is great, and the other half developing them after protocol development, and 5% saying they do not develop recruitment tools. I'll share those on the screen.
Great, thank you, Ryan. And a lot of times, when we're coming on board for studies, we are developing materials after the protocol or alongside the protocol, and we pull a lot of that information out into the materials that we develop. So keep that in mind. Just moving on. So as I mentioned, step one is researching the target audience and really understanding who they are. So as you go through, you want to understand that patient population, because that's really the key to developing a successful recruitment strategy and successful recruitment materials. So the first step is to identify your target audiences, and I do have that as plural. There are typically more than one target audience. So a lot of times you'll see that you're targeting the patients themselves who will be enrolling in your study, but you can often target caregivers or loved ones who may also influence them or play a part in their decision to participate. We see this a lot with Parkinson's studies or Alzheimer's studies, where that caregiver is really playing a critical role in the healthcare provided to that patient. It could be the parents or the guardians if you're doing a pediatric trial. A lot of times young children, they're not seeing the message, but their parents or their guardians are. So you want to be strategic in the messaging that you develop to make sure that you're reaching that right audience. And then a big audience for us here, and which could be for your study as well, are other physicians, referring physicians who may pass patients on to your study, having physician-friendly materials that you can share with them as you're doing outreach is equally important as targeting the patients and the caregivers themselves. And then you want to determine where they're going for health-related information. When you understand the touch points that they're going along in their journey, you can really figure out where you can intersect with them to get your study message in front of them and the types of materials that you'll need throughout that process. So we put together a tool here for you that you can use when you're identifying your study's target audience. And I'm happy to share this after the presentation today. I'll have my email address on the last slide that we have, so feel free to email me if you want a copy of the slides or this slide, or just have any follow-up questions. I'm happy to be available to you. But when you're going through this process, you want to identify the demographic information of that population, their age, their gender, their race, where they're located around the sites, and keep note of that as you go through the research process. Any pain points that these patients may be facing, both emotional and physical. A lot of conditions come with daily struggles, and understanding those pain points will really help you reach that audience and let them know that you understand what they're going through and that your study is an option to them. And then equally important are any motivators that would lean them towards participating. If you can identify what those motivators are, you can speak to that in your content that you develop and just kind of show them that, again, you understand why they may want to participate, and you speak to that clearly. And then, as I mentioned before, where they're going for health-related information. And that can be both online and offline. Identifying all of those different avenues will be important as you develop your recruitment toolbox. And then as part of that first step, you're really building that patient profile, who your target patient is, as well as the pathway they take through their medical journey. And we have 8 questions here to keep in mind as you're doing that research and gathering all of that information. The first one being, what are they doing as everyday activities? Are they spending time at the gym? Are they going to the grocery store, going to places of worship, attending local community events or support group events? Are they going to their pharmacy for medication pickups? All of those places are touch points in the journey where you can place study messaging and study materials and get in front of them your study message so that they can take the steps to learn more about it. As I mentioned again, where are they going for health-related information? Are they turning to their local medical community or their physicians for information about what's available to them and any studies that they may qualify for? Are they turning to local leaders in their local community or advocacy groups? Are they going online and doing research? Or are they spending time on social media? The more you know about your patient, the more you can figure out where they're looking for this information so you can place your study information there. And the next 2 questions go hand in hand. It's what types of doctors are they seeing for this condition, and what are they currently doing for their treatments? Again, these are just touch points, again, along that journey that you can intersect with to really understand what they're going through day by day and how this study may play into their lives. And then the next 4 questions will really help you when you're developing your content. So it's understanding their pain points, living with this condition. If they have a chronic condition, how is it affecting their daily life? Is transportation difficult? Or is it difficult for them to leave their homes? A lot of those questions, if you take a second to think about, the daily struggles that they face, when you write your content, you can answer those questions and how you've thought about that in your protocol, how you've thought about that when you built out your study visit schedule. And that can answer a lot of their upfront questions or help you overcome hurdles that they may face when they're considering participation. And then what are their motivators or hindrances to participation, and what might convince them to participate in your particular study? Those are all really important things to kind of understand before you even begin putting pen to paper and developing the materials. And then step 2 here is branding your study. So we'll stop for another quick poll question just to gauge how many people are actually branding their studies, and I'll let Ryan post that up for everyone to answer.
So our next question is, do you brand your studies? Yes or no? Give about 5 more seconds. And as you can see, 63% of responders do brand your studies.
That's great to hear. It is a great way, and I'll speak to that more in a few seconds here, of keeping your study top of mind. And I hope in the next few slides, I do give good reason for why study branding should occur. And maybe when we take a poll on our next webinar, we'll ask that question again and see if those numbers change. So why should you brand your study? When you're branding your study, you're really helping to create a study identity. And this allows both patients and site staff to feel like they're really a part of something important and they're making a difference. And it also makes it easier for them to remember your study and keep your study top of mind. When you go on ct.gov nowadays, you see so many studies out there, and a lot of them are the XYZ 301 study or the XYZ 302 study. And, that's fine, but it is harder for patients to remember if they're going to look up your study after they speak to someone about it. And it's also harder for the site staff to juggle all of those different protocols and numbers that they're working on. Where if you create a concise and relevant brand to your audience, it's easier for the patients to remember that when they're doing research on it, or for your site staff to remember that they're enrolling the CLEAR study when they have a patient walking through the door who may qualify. And then just the things to think about when you're branding your study. You want to make sure it relates back to your study's target audience. That's key to everything that you're building in this toolbox. Is that target audience should be front and center, and their needs should be kept top of mind. And you also want to think about a few additional items, the feelings that you want to convey and avoid in branding and how you present your study to individuals. The colors that you select and the fonts that you select are really important. Each of those pieces carry different connotations and feelings for people and elicit different responses. So you want to be thoughtful and strategic in those colors and fonts that you're selecting, as well as any images or illustrations that you're using. And then your overall just steady name and the logo itself, always relating back to that target audience. So we have 2 examples here from some of our past studies. The first one being the Olivia study. It was a pediatric study of the ear. So we had the elephant here really highlighting that ear area on their body to play into the overall study protocol and what was being tested. And then we used a fun font to really draw in the eyes of the parents and the children who could be participating in this study. And then the second logo we have is the Face It study. And this was for an acne study that was focused just on the face. So we use, what was being tested and what area of the body was being looked at in our branding. making it really easy to remember and relatable back to that study's target audience that we were reaching out to. And then step 3 is developing your key messaging. And your key messaging is what's going to be used across the board. So you'll kind of brainstorm on what that initial messaging and how you want to convey your study, and then you'll carry that through into all of the materials that you create. And as you're going through, you want to think about how you want to communicate your study to the potential participants, to their loved ones or their caregivers, as well as any medical professionals who could be referring patients on. And as you work on your messaging, think of these 2 questions and find answers to them. The first one being, why does this study even matter? If you can't sit down and think of an answer to this question, it's really hard to ask that of a patient or a study coordinator who's recruiting for your study. You want to provide that answer to them and make them feel like this study does matter, it's important, it's necessary, and it's something that they want to be a part of. And then the second question is, what makes your study different from other competing studies? There are so many other studies out there for each therapeutic area and condition, indication, and you're really going against everyone else who's looking for that same patient. So you want to make sure that you understand what makes your study different and that you're conveying that to these different audiences so that they understand it as well. And that's really done through the content that you create. And then the 4th step is outlining your patient pathway. You want to figure out where these patients are going, where these caregivers are going, and how you will reach them. Every patient in their journey takes a certain pathway to assist them in their condition management, and you want to define that for your specific target patient. If you're getting this information in front of them and you're getting the right information in front of these individuals, they become more informed, they become more educated about your trial, and they become more likely to either participate in the study or refer patients onto the study. So we broke down here just 3 different types of advertising or outreach that you can do. You have your online advertising through social media. Many people are on social media nowadays, and this is a key driver for recruitment. So have your digital advertisements, your campaign built and ready to go, so you have it available to you when you're ready to launch your campaign. Google Ads is another great way to get in front of patient populations. People are online looking for information, looking for an answer. And when they're online looking, your study can show up as an answer or an option available to them. Any health support networks, people are, like I said, going online for information. They're looking on WebMD. You can advertise there as well. So have patient-friendly advertisements created that can be placed on these different networks. And then one thing that I think is often overlooked is the site's owned media, their own social media accounts, their own websites. Create content that's IRB approved, EC approved, easy for them to implement, that they can post on their own accounts or they can post on their websites, and just get your message in front of their audience easily. The second one being traditional advertising. Traditional is not dead. I know a lot of people still say that, but it really is, depending on the protocol, depending on the patient population and how long you plan on advertising, a great way of reaching new individuals and getting your study message out there. So have a 30-second radio ad ready to go and produced that you can place on local stations around the site or internet radio stations. Pandora and Spotify are becoming very popular and highly used. Place that 30-second advertisement on there as well. TV and streaming devices, there are some people who still plug into the cable and watch TV the traditional way, and there's some people who are cutting cable and turning to streaming devices like Hulu and Netflix and Roku. So have a 15 and a 30-second TV spot created and produced, IRB approved, ready to go. So if you need to do TV advertising, you have it available to you. And then your newspaper publications and your outdoor ads, have that standard advertisement ready that can be resized for certain publications that you're placing that advertisement in, or think about where you can create advertisements to place outside of the home, whether that's billboards, bus ads, train stations. People are going out every day, and we're starting to see that a little bit more with the COVID slowdown. And you want to make sure your study message is available and present. And then your non-traditional advertising. If you're doing any media outreach and you're reaching out to local publications, have a press release ready that you can send to them, and they can use that and repurpose it in their article. If you're looking to do some word of mouth advertising, which is a great and free way, create a refer a friend card or a refer a friend postcard that someone may share with a friend or a family member that they think would qualify. And then if you're doing medical professional and physician networks, reach out to, have that physician facing material ready to go. So when you're reaching out to them, you can send something along with your message that's tangible for them to read and hold on to. And then when you're doing advocacy and support group outreach or national and local organization outreach, have patient-friendly materials ready, flyers, brochures, things that these organizations can easily share with their network or their database of patients. And that just helps you spread your message so much easier. And then we have step 5, which is developing your toolbox. So you did all of your research, you branded your study, you did all of the front end work, and now you're developing the materials themselves. So we have here a list of materials for you to consider, both patient-facing and physician-facing. You have flyers, brochures, and posters. That's pretty typical across the board, people use in their studies. But you want to keep in mind about sizing and where you're placing these materials. If you're posting them in a site's office, make sure it's big enough that when someone is sitting across the room, they can still see it. So posters could be the way to go if sites have the space for them. A lot of times we've heard of sponsors sending brochures to the site, which is a great handoff piece for the PI or the study coordinator to give to patients as they're presenting your study. But it may not be the greatest material to sit out in the waiting room because it's smaller. People may miss it, or there may be other brochures out there fighting for that patient's attention. So have some larger dimension pieces to go along with those brochures and flyers that have your study message on it. We have protocol presentation flip charts. We use these frequently on our studies where, the informed consent document, it's long, it's tedious. Some patients, when they start reading it, they really struggle to understand. So we put together flip charts that the study coordinator can use as a guide when they're walking the patient through the ICF to really understand the different parts of the ICF before they sign, understand what's going to be expected of them during the study, what they can expect to experience during the study. And it really helps make sure that each study coordinator and each site recruiting for your study is sharing your study message in a way that you want it to be presented. Digital advertisements, if you plan on doing any social media or online advertising, as I mentioned, have those created and ready to go. Patient videos are great as well. We have a few different versions that we use here. One being just general awareness videos about your study that can be placed or used in the site's waiting room, or if you're, working at larger institutions in their the area where people walk in, their entrance, things like that. It's just another touch point or another place to get your study message in front of patients. We've used consent and assent videos, again, going back to that ICF. If people, if you want to make it easier for someone to understand, have a video they can watch prior to signing or prior to screening into the study that gives a general overview of what to expect. And then a big one nowadays is training videos. A lot of these study procedures and things are being done at home. Injections are being given at home. Study devices are being used at home. People are filling out study diaries, or, there's so many requirements. And the study coordinator will take the time to speak to the patient about that during their screening visit and onboarding process. But what happens when they get home and they forgot what they were told, or they don't remember the details clearly? Having that video available to them that they can watch on their time, as they're actually going through that process at home, is really helpful. The doctor to patient letters, if you're doing chart reviews or database searches, it's a great templated letter you can give to the PI. They can just customize their information and send it out to any patients that they think may qualify. And then we have the 70-inch high banners. This is going to be site dependent on their space available to them, but we do find that having these retractable banners available to the sites that they can place in their waiting rooms or their exam rooms, it's a great, large dimension piece where you can clearly outline your study for people and patients. Or if you're doing local community events or screening events, take those with you and have that propped up at your booth or at your table. So people walking by can see it and then can stop and ask more questions about the study. You have your refer a friend cards, your postcards if you plan on doing any direct mail, your internet posting that sites can use on their social media or their website, the press release for any media outreach that you plan to do, and then a study website, which I find to be one of the most important pieces in your toolbox. And I'll talk to that in a few seconds here. And then your referring physician materials. I think a lot of people know about the doctor letters. A lot of people use them. It's a great way for the PI to share that message with a referring physician or someone in their naturally referring network. But as we've gone through this process, we've heard from referring physicians that they want just a little bit more information. There's only so much you can fit in one letter. So just some other materials that you can include in what you send to these physicians: the IE criteria cards, what they're looking for in their patients and what criteria their patients need to meet to qualify. Study coordinator contact cards. If you're sending this material out to the physicians and they have follow-up questions, give them the information of the study coordinator so they can easily get in contact with them and ask them those questions. The ideal study participant profile is just an extension of that IE criteria card, but it's really showing that referring physician who you're looking for and who your ideal patient is for this study. Information on the patient experience and study expectations. The referring physician wants to feel comfortable with their decision to refer that patient on. So if they can understand what that patient will be going through in your study, what's going to be expected of them, how many study visits they need to go to, they'll feel comfortable making that informed decision to pass on that patient to the study. And then just awareness and study materials that are patient facing. You're probably already creating these for other outreach methods that you're doing. So you want to just include those in the packet that you send to that referring physician. As they're presenting your study to their patient, they can hand them a flyer or hand them a brochure, something that they can take home with them after the fact to follow up, go to that study website and learn more information.
Gabby, we have one quick, before we get to the poll, we have a question from the chat.
Sure.
How do you get sponsors to see the need to include sufficient budget for the materials you listed?
I think it speaks to past results for us. A lot of patients that we see come through our screener or come through the study do source those study materials as how they heard about it. So it is really important to have. And I think when you have someone who's creating the whole package for you, you start to gain efficiencies in budget. So if sponsors are looking to have this created, go to a recruitment company that can kind of do the whole package for you, because you will gain budget efficiencies there. And it's just a great way, especially digital advertising nowadays and study materials that are being placed in the office. These are those key touch points that you're getting in front of patients at critical points in time when they're looking for that information. And if you don't have those study materials available, they're never going to know that your study exists. Some people do go to clinicaltrials.gov or they, find the study that way. But the majority of what we see is either, it's all through direct to patient advertising, either through online advertising or the materials that we produce.
And our next polling question: do you still provide your sites with printed materials for in-office use, or do you give them digital PDFs for them to print on their own? We'll give about 10 more seconds. And as you can see, 75% of, about 75% of everyone in the group still gives printed materials. 21% provide digital PDFs so that the site can print, and 5% do not provide sites with materials. These are some very good results.
Yeah, I think it's great to see If you're professionally printing those materials and sending them onto the sites, it's a great way to alleviate that burden for the site so they don't have to find the time to print or find a printer. You're just already kind of handing them a package that they can go out and use right away. I saw in the chat that some people do both, and I think that's fantastic. Having the printed materials ready and available for them that they can place in their office or hand to patients as they come through is great. But a lot of sites are also doing, online outreach or email outreach. So having those PDFs available where they can use it as an attachment in the email that they're sending to their patients or their database is also really useful. So it was great to see some people saying that they provide both options. And then going back to a point that I made earlier, it's developing a study website. This is a really critical piece to have in your toolbox. If you're doing any type of outreach, if you're doing online advertising or traditional advertising, or either just reaching out to the community, if someone picks up a flyer, if someone hears about the study from their physician, 9 times out of 10, they're going online to look up your study for more information. And having that study website and an online presence is really important so that when they're going to look, you're there, right? You don't want to miss an opportunity if someone is looking for more information by not being available online. And we've heard, well, I have my clinicaltrials.gov posting. Isn't that enough? Can I point my ads to that posting? I highly recommend everyone still post to ct.gov. It's a great resource, a great way to get your study out there. But a lot of times the postings are a little too scientific for the general public, or it's a straight copy paste of the inclusion exclusion criteria. And, someone who's interested in this study may not understand the medical language that's being used. So having that study website available to them, it's a little more patient friendly and easy to understand is the best way to go. And as you're building this study website, think about providing the following information about the study. I know I mentioned this before, but the study requirements, the number of visits, an overview of the study drug or device that's being tested, what's going to be expected of them, if they have to fill out a study diary. You want to give them enough information that they feel they're making an informed decision about participating. And, I caution as well that you don't want to give too much information. There are still some things that are best kept to a conversation between the study coordinator and the patient when they're coming in for that screening visit. So you don't want to give, the whole kitchen, just the kitchen sink sometimes, and let some of those more critical pieces be answered in person when there's an actual person there to talk through those details with the patient. And then include general frequently asked questions about clinical trials. I think with the current COVID environment that we're in, people are becoming more aware of clinical trials and their importance, but there still are some people who are hesitant to participate. And if you can answer those general questions that people have or those general concerns that people have ahead of time on your study website, you're again overcoming those hurdles that someone may face when they're deciding whether or not they want to take the next step. And then also include information on the site locations. People coming to the website will want to know if a site is near them. So include the city and state of each of the sites that you have enrolling for your study. My recommendation is to keep the study contact information off of your website. And that takes me to my next point. It's because we want people to go through a pre-screening process. So as you're building your study website, include a web-based pre-screener. When you start advertising, when you start doing outreach, you will have an influx of patients coming to this website for more information or wanting to, participate, but not all of those patients will meet that inclusion exclusion criteria. And if you send every single patient that comes to your study website or that's interested in participating onto your site, they're going to become burdened with a high screen fail rate, and a lot of frustration is going to be built up. Where if you have that initial pre-screener on your website, where you can just ask some simple questions of the patients and weed out those who clearly don't qualify, you're increasing your chances of sending a highly pre-qualified patient onto the study coordinator and onto that site who's likely to end up enrolling. And that just makes for a happier site, a happier study coordinator, and a smoother process for the patients as well. And this will take us to our last poll question, and I'll pass it over to Ryan.
Yes, our last study Our last poll question, if you develop study websites, do they include a pre-screener? Yes, no, or I do not develop study websites. We'll give 10 more seconds. Okay, close the poll. As you can see, phenomenal. 63% are including an online screener in their website. 5% do not, and 32% do not develop study websites at this time.
Great, thanks, Ryan. It's encouraging to see that majority of people are including those screeners on the websites. It's a great filtering process and a great way to capture that patient information right up front, and then have a process in place for managing those referrals. When you're collecting all of that information, it's easy to track that patient, where they came from, how they heard about your study, all the way through to whether they screen fail or end up randomizing. And then everyone who has said that they didn't put study websites together, if you have any questions about building those or the need for those, I'm happy to take some time to discuss offline. Please feel free to shoot me an email or drop a message in the chat, and I can follow up with you. All right, so that takes us to, you've spent the time, you did your research, you branded your study, you've developed that key messaging, figured out where patients are going for information and how you're going to connect with them, and you built the toolbox. And now it comes time to actually put that toolbox into place. The worst thing that can happen is, that toolbox just sits in the corner and collects dust. So you want to make sure that you have a plan in place to effectively use all of those materials that you spent so much time and energy creating. So make those materials visible in each site's office, the waiting rooms, the exam rooms, any other place in the site's location that patients are interacting with. And then explain those tools that you created to your sites and give them tips on how to use them. You spent a lot of time thinking about, how your outreach methods will be used and how those tools will help you in those outreach methods. Just take a few more minutes and put a quick guide together for your sites so they can understand what's available to them and how to effectively use them. It maximizes the time that you spent, and it maximizes the reach of those materials. And then place your materials within the site's community at those key patient touch points we talked about in the very beginning. If they're going to the gym, if they're going to the grocery store, if they're stopping at the pharmacy for their medications for this condition that your study is focusing on, have those materials available there. Speak to people in each of those locations to see if it's okay to post your materials there. A lot of people will, they see it, they'll grab it, and they'll want to learn more. And the only way to make sure that happens is to make sure those materials are being placed in the appropriate locations. And then taking it just a step further, a lot of studies happen here in the United States, but there are so many that are happening outside of the US as well. So it's really important to maximize your toolbox global reach. The materials that we create here in the US, they're not going to be as effective in other countries. So provide translated materials per country. And even taking that a step further, provide translated materials per language needed within that site's community. Oftentimes, a certain country will speak more than one language. A great example of that is here in the US. If your site is located in Miami, a high percentage of them will be English speaking as well as Spanish speaking. So having both sets of materials available so they can reach their entire patient database is critical. And then you want to update your images as needed. Remember here who your target audience is and find images that are relatable. I know a big buzz in the industry right now, and a lot that people are talking about is diversity and inclusion. And how can we make sure that our studies are reaching a diverse population and enrolling a diverse population? And that goes back to the materials that you create. If someone picks up a flyer and they see, someone who looks like them or someone who is in their race or their ethnicity, it's relatable to them. Right? So think about the different demographics of your patient population and the site locations, the race and ethnicities of those site locations. Have multiple sets of materials available depending on where you're sending them, and what that patient population looks like and that demographic in that area. Have those types of updates made to your materials. And then something that maybe people don't think a lot about, but really does carry importance, are the colors that you use. Colors in certain countries carry different meanings. One project that we had here in the United States, we were using a lot of greens and blues, which is, perfectly fine here. But when we were taking our recruitment efforts to South Africa, those colors carried a different meaning there than they do here. Greens there can carry meaning of death, blues, mourning, and suffering. And those were two colors and two meanings that we didn't want our study to convey, or the study that we were working on to convey. So when we put our materials together for South Africa, we had different images that we were using. We translated the materials, and we had a different color palette that we used on those materials as well. So it's really thinking about how you can customize down to the country level or the region level, and be cognizant that, there are cultural differences, places, and you want to be respectful of that in the materials that you develop. And then just to kind of summarize everything, I know there was a lot covered today, but just the key points to remember and take away from the presentation. Gain a deep understanding of your target audience. This will be the basis for everything that you do. If you understand who they are and who you're going after, you can relate to them and they can feel comfortable with participating in your study. Brand your study to make it easy to remember for both patients and site staff. Develop messaging and use images that speak to your target audience. Like I said, the target audience is the key to everything. If they're not buying into your study, you have no patients enrolling. Create a website to provide these potential patients with more information. Right now we're living in a consumer-based world. And while these aren't technically consumer products at the moment, where people that we're targeting still have that consumer mindset. They want to have their questions answered. They want to have information available to them before they move on to the next step. And that study website is a great way to do it. Pre-screen those patients that come to your website through that pre-screener so that you're only sending pre-qualified patients onto the site for further screening. And then use your materials effectively. Like I said, you spend a lot of time and effort building the materials, and you want to make sure that they're used properly. And then adjust your materials for each country in which you plan to recruit. I know we just talked about that, but again, that is crucial as you're going through, especially when you're dealing with ECs and getting approvals. Having those small adjustments made makes that process so much easier. So with that, I'll open the floor to any questions or comments that anyone had. I'm happy to take some time to answer any for you. And I also have the contact information for both Ryan and myself if anyone wants to follow up with us directly after the webinar.
Thank you, Gabby. Yes, we do have a couple of questions in the Q&A. The first question, what are the top three materials for in-office use?
I think, a flyer is a great piece to have. It can be used in the waiting room, sitting on the table, or it can be a great talking piece that the PI or the study coordinator can use as they're presenting your study to their patients. I think a brochure is another great piece that gives a little bit more information than you can fit in a flyer. So if someone is really interested, it's a great take-home piece for them to sit down and read more and digest. And then I would say either the poster or the retractable banner if there is room for it in the site's location. Those larger pieces, like I said, when someone is sitting across the room from where your study poster is, you still want them to be able to identify the study message and read more about it.
Thank you. Next question. What is the best practice to help sites use the social media post on their own pages?
So having a toolkit, we put together, a few different ad pieces or ad content variations and approved images that the sites can use. And you can share that with your study coordinators on the sites that they can post on their own. So with Facebook and Instagram, there are certain pieces of information that need to be included. You'll have your headline, your description, your website URL, and your image. And then if you're advertising on Google, I think now they're up to, you can have 3 headlines, 2 descriptions, some site links, things like that. So it's important to dive into the requirements of each of those platforms. They all have their own character counts that are allowed and different rules on things that will get approved. But building that toolkit ahead of time and getting that IRB approved so that your sites just have something they can copy and paste versus having to build that toolkit on their own is important. As well as the internet posting, which could just be a small paragraph about the study with an accompanying image that they can use as a Facebook post or an Instagram post versus an advertisement, or they can use that as the information that they upload to their site website. Again, the more you can get IRB approved and kind of package it up nice and pretty for the site, the easier it will be for them to use and implement.
Perfect. Another question for you and also for the other participants, so please answer in the chat. How much do you involve your PIs and sites in reviewing materials for their given country? Curious if folks use sites as a sounding board on language and color, etc.
Yeah, I'll let everyone jump into the chat. I think that is a great thing. They are local to the area and understand it. Here internally, we have our local enrollment specialists who are in those local regions. When we go globally, they're living in that country, they're speaking the native language, they're understanding the cultural regulations and the ECs. So we do tap into them as a resource when we're putting materials together and putting strategies together on what's going to be most effective and how that will be taken in by the audience and how it will resonate with our target audience. So I think it's a great resource, if it's the local enrollment specialist here, the site, the study coordinator, just having someone local to that area kind of give their insights as well really goes a long way.
Thank you. Another question from the chat. In your experience, what is the most effective piece of advertising for clinical trials outside of the US, i.e. Eastern Europe, Middle East, etc.?
For us, it is country specific. Digital advertising does work in a lot of those countries. You just have to do your research on what's approved. But 9 times out of 10, you can either advertise on social media or Google. Some countries do allow both. We find that to be a huge resource for us. And I know they only asked for 1, but I'm going to break the rules and give 2. Another one is the referring physicians. A lot of these are working in practices where they can receive patient referrals from other physicians in their network. So having those physician-facing materials ready to go is useful as you're going into other countries.
Thank you. Another question. Are there cost-effective methods to develop and host a study website?
Absolutely. So for our study websites, a lot of times people think you have to have a website per site, but we typically build one centralized website, and then we list all of our site locations on there. And then on the back end, our pre-screener will have all of the site's zip codes built in. And as a patient comes through, they read more about the study, they decide they want to fill out the pre-screener, we'll ask them for their zip code. And then based on that response, a site will be assigned to them if there's one near them. So I think having one centralized website that can be used across your entire study for all of your sites is important. And you can do that in each country. Just have a country-specific website for each region that you're going into where you list all of those site locations. And then on the back end, have those sites built into your pre-screener so a patient can get assigned to them.
Perfect. One last question. How can you brand studies in a cost-effective manner?
You said, how can you brand studies? Is that the question? Sorry, Ryan, you were breaking up there for a second.
Oh, yes. How can you brand studies in a cost-effective manner?
Yep. So I think, once you have your initial brand put together and you have your logo developed, that gets carried through to all of the materials that you create. So, researching that audience up front, understanding what's going to attract them to your study, and then putting that in place. And then you create materials, branded materials that can be used at all of your site locations. I think the only, kind of cost prohibitive pieces if you are doing translation for other countries, but even that, it's a very minimal cost to get those translated if you have someone who is able to do the layout for you. So I think it's keeping those materials more centralized and something that all sites can have access to.
Perfect. That is all of the questions. If anyone has any additional questions, please feel free to use the Q&A or put them in the chat.
And if anyone has any questions after the webinar, I know, sometimes thoughts will pop into your head an hour or so from now. Please feel free to reach out to us directly. We're happy to give insight into any materials that you're developing or give you just some thoughts and recommendations on how you can move forward on your study.
Well, thank you all for joining the second in our patient recruitment series for 2021. Our next webinar will be in June, and you should see an email about how to register shortly.
All right. Thank you so much, everyone, for taking the time today. We really appreciate it and look forward to connecting with you either after this webinar or on our next one.
Thank you.